you for joining us for another episode of Senior Answers. My name is Maria Madrid, Director of Latino Services at the Colorado Gerontological Society. Today we'll discuss COVID-19 and caregiving. We have a wonderful guest with us today. Her name's Stacy Naslund. She's a volunteer educator with the Alzheimer's Association Colorado chapter, and she is also an executive director at Spring Ridge Park Assisted Living. She comes with a lot of expertise on caregiving and dementia. We're happy to have you. So Stacy, I'm so excited you'll be talking to us about these three things. So COVID-19 and dementia, you'll give us some tips for caregivers, and then you'll give us some of those wonderful free resources from the Alzheimer's Association. So let's start with COVID-19 and dementia, because this is a question that a lot of people have. Does dementia somehow increase the risk of my loved one to get COVID?
Yeah, great. Thank you, Maria. Thank you for having me. And that's a great question to start with. A lot of people, the misconception is that dementia will increase the risk for developing or contracting COVID-19, which is not necessarily true. Most likely what happens is the condition that goes along with dementia, the forgetting, that sort of thing, increases their risk for contracting the virus, COVID-19. So what happens is with dementia-related behaviors, which means, forgetting to wash their hands, forgetting to wear their mask in public, hugging others, touching others, all those things that we're supposed to be doing right now, social distancing, somebody with dementia doesn't always remember. I hate to use the R word, but that's what happens is that they're not aware of all of the things that we're doing right now to protect ourselves. So that's what increases their risk, not necessarily having dementia or the diagnosis of dementia, but those behaviors or forgetting to practice social distancing and washing our hands and wearing our masks, all those precautions that we're all taking right now. Someone with dementia might forget to do those things. So that's what increases their risk.
Thanks, Stacy. So now that we know that having dementia does not have an increased risk for COVID-19, let's talk about tips. I think this is an area where caregivers sometimes need some support to just kind of figure out where they need to go. Can you tell us more?
Sure. So I highly encourage all the caregivers out there to visit our website, www.alz.org/COVID-19. On there, you will find all of the stuff that you're seeing on the screen right now. You will find, we have just tons of resources and tips for people at home, for tips for folks with who are taking care of their folks with dementia. Sorry, I can't talk today. So I really encourage you to visit our website and take a look at all of these great resources and tools that we have for people at home right now. You're going to get things like how to encourage somebody with dementia to wash their hands more often. How do we make that successful? How do we make that fun? Remembering to use alcohol-based hand sanitizer. Maria, we could go to the next slide because I'll show you some of those tips. So, but I encourage everybody to definitely visit our website because you're going to get a lot more of this information on our website as well. So some of the things that the CDC has come out with in the last year and things to consider when you are caring for somebody at home is, reminding our loved ones to wash their hands, maybe placing signs up, doing it with them, because that always helps drive home the point, or it helps them be successful if the care partners can do things with their loved ones. So when we're washing our hands, everybody's washing their hands. When we're washing our hands, we have to do it for 20 seconds. So we sing happy birthday, we sing Merry Christmas songs, whatever you can do to keep your loved one engaged for those 20 seconds, washing their hands with soap and water and keeping them active. Again, demonstrating through hand washing, doing it with them. That's always the best way to get them to do anything. is by doing it yourself, and that demonstrates to them what you would like them to do. Again, using hand sanitizer is always a great tool in between hand washings in lieu of. I know here at Spring Ridge, we do, before meals, we pass out warm washcloths. We put some sanitizer on the warm washcloth because everybody loves a warm washcloth, right? And we can wash our hands that way before we eat. Taking them to the sink isn't always feasible, or maybe they're not real into getting up to go to the sink, or don't understand, or maybe they're reluctant to do that. So hand sanitizer is always a great alternative. Even sanitizer wipes. You want to be careful to stay away from the ones that, like the Clorox wipes, things that are meant to clean surfaces, because those aren't good for our hands. And if we put them in our mouth, they have bleach on them. So make sure you're getting skin safe hand sanitizing wipes, but that's a great alternative too. That way, I know I've had this experience happen when somebody's put a dollop of hand sanitizer in someone with dementia's hand. They're not sure what to do with it, so it goes to the mouth. And that's not good. It won't hurt them, but it's also not good for them. So that's why the sanitizer wipes are such a good tool to use as well, when you can't actually get them to the sink and wash their hands.
So Stacy, I want to ask you a question because, we're spending more time at home, and sometimes there are red flags that we should be doing things. And can you tell me what rapid increase in confusion, why is it a red flag, and what can caregivers do about this?
Yeah, great question. So with dementia, it is a slow progressing disease. So nothing really happens overnight with dementia. So if you are seeing a rapid increase in confusion or behaviors or things like that, you always want to contact your care provider, your physician right away, because that is a sign of something else going on. Maybe the beginnings of illness, maybe a infection of some kind, a urinary tract infection. So certainly in the days of COVID, where we're on high alert about all symptoms anyway, this would be a big one for our loved ones with dementia. Anytime there's a sudden change in condition or a rapid decrease in abilities or increase in confusion, that's always a red flag of something else going on, possibly illness, possibly infection. So that is why you really want to reach out to your primary care physician and get your loved ones seen right away to rule out everything, and then also get them tested for COVID too. Even though there's not a lot we can do for COVID right now, we still can monitor those symptoms and get them, if it is truly COVID, then we need to put isolation and quarantine precautions into place and all of that. But definitely some things that we can do at home is looking for those signs of illness, which could be increased confusion, which could be increased behaviors. They may not present like you or I would present with an illness. So that's why we have to really key into those little changes and the big changes. Some other things to really help, through these days that we're all home together is requesting greater number of days on your prescriptions. Instead of getting 30 days, get 90 days. That way you're not having to expose yourself and your loved ones, going to the pharmacy. Day programs and respite care have been kind of limited in this last year. So making plans, alternate plans for yourself and your loved one to give you a break, because that's really important. And then what happens? Do you have a plan in place if you, the primary caregiver, gets sick? So those are all things to think about too when we're at home through all of this.
Great tips for at home. What about tips if you're getting in-home services? So first, can you answer for me, for those out there listening to us that do not know what in-home care services are, and then some tips on how to manage that when you're a caregiver?
Sure. So, that first bullet or that third bullet point on our screen, making alternative plans for adult day and respite. So that would be, like Maria mentioned, bringing in-home or home-based services into the home. So that looks there's a lot of different options for that, which is great. So home care would be the first one that comes to mind. We have two different kinds of home care here in Colorado. We have, in most places, we have non-medical and medical home care. Non-medical is going to be the companies that you hire, or maybe somebody that you hire off of care.com or program like that, to come in and help with kind of the day-to-day stuff. This is very helpful for people with dementia. It provides companionship, socialization. It provides people at home, the caregivers at home who are doing this at home, your own respite. You know, you need to have respite too, which means a break. And that's, respite is a nice big word for break. You know, you need to get some rest, and whether that means you have some time now to go to the grocery store because you brought home care in, or they call it personal care provider. You've brought somebody into the house to take care of your loved one, to look after your loved one, keep them safe while you can go out and run errands. Maybe it's as simple as you needing a nap. You know, you can go upstairs, close the bedroom door. You know your loved one is being looked after and taken care of by somebody, so you can get some rest. And that's really what it is. And then we have medical home care, which are going to be the nurses and the physical therapists, occupational therapy, and those kind of people. Those usually need to be referred by your physician to come in and help. But I think the big thing, you know, for home-based services is definitely going to be those non-medical home care providers that can come in. They can do some light housekeeping. They can, you know, do, like I said, socialization. They can take your loved one for a walk. So when you are bringing people into your home, realize that they are other places than just your home, right? They are out in their own homes and going to other people's homes. So you do want to ask those questions when you are looking into bringing somebody into your home, whether that be somebody just care.com, or you're hiring an agency to come in and do to help you out. What are their protocols? You know, especially agency. What are their protocols? Are they screening people? Are they testing their staff for COVID on a regular basis? Now that the vaccine is becoming more widely available, are the staff, or can I request somebody who has been vaccinated? Because that reduces your risk as well. You always want to make sure, is there some kind of protocol? You are more than welcome to ask them to take their temperature and ask them for symptoms. You know, have you had any signs and symptoms? Have you been in contact with anybody in the last 14 days that has tested positive for COVID? So those are all ways to, things to do to keep yourself safe, keep your loved ones safe, and making sure that the people that are coming into your home are also doing their part to keep themselves safe, in turn keeping everybody else safe. So, you know, it's okay to ask that agency or ask that person, how many people do you go to? How many homes do you go into? You can ask them to wear a mask in your home. I highly encourage it and recommend it, you know, because again, we don't know where they're at when they're not in your home. So we need to make sure that we're requiring those safety precautions in our home as well as out in public.
Those are wonderful tips, Stacy. Thank you so much. Let's go into an area where you have a lot of area expertise, that is assisted living. Can you tell us about residential care, what it is, and some tips if you have a loved one living in that setting?
Yeah, absolutely. This is my bread and butter. So I've been living in this world for the last year in a residential care setting. So residential care is just what it sounds like. It is when you have actually moved your loved one into a home, whether it be assisted living, memory care, you know, some kind of senior living where it's communal living, residential care, right? Where they're getting some assistance, but they're living in a home. So you really want to check with the place that they're at, the residential care setting that they're at. Check with administration. What are the protocols? What are you following? Health department regulations? Are you following CDC regulations? Are you governed by CMS, which is the Centers for Medicare and Medicaid? Most skilled nursing facilities, that's kind of the CMS, Centers for Medicare and Medicaid, are the ones that govern. That's the federal governing body over senior living. So what are the practices that the residential care setting is following? Are you screening people when they're coming in the building? Are you allowing people into the building, and who is allowed to come in? And what kind of screening are you doing? What kind of requirements are you requiring those people coming in? Do they have to show proof of a negative COVID test in the last week? Are they vaccinated yet? So that's okay to ask, find out what's really going on. And a good care community is going to be communicating all of these things with you. These are our protocols. This is what we're doing. Obviously, visitation has been very limited in this last year for friends and family, which we are starting to get to a place where we are opening up a little bit. So how are we keeping your loved ones safe when we are opening up to more visitors? And what does that look like for everybody? How are we going to maintain contact with you when you can't be here every day and seeing your loved one and being part of that process? How is the community going to communicate changes with you? How is the community going to inform you of changes or things going on? And the other part of that too is ensure that they have multiple emergency contacts, because if there is something happening and they need to get a hold of you and your family, if they can't reach you in an emergency, who else is on board to be contacted so that everybody can be on the same page and up to date on what's going on. So those are just some things about care communities, residential care settings.
Wonderful. There's, and you kind of led to what I wanted to ask you next, and that's, caregivers are put in a situation where they have to advocate for their loved ones. And for a lot of caregivers, this is new, and they really don't know what they should be asking when their loved one is in residential care in the middle of a pandemic. Can you give us some more tips on what people, caregivers should be doing in that situation?
Yeah, you bet. And again, be patient with your care communities, because we are all navigating this at the same time you are. I have a family member that says, in college, you probably had the choice between taking what to do in a pandemic class and a modern dance class, and you probably took modern dance because none of us ever thought we would be in this middle of a pandemic and dealing with this craziness that this last year has been. So great questions to ask your residential care, and like Maria pointed out, be an advocate for your loved one. This has been a really hard year because families and friends have not been able to be in care communities where normally you would be in there on a regular basis and advocating for your loved one in person in that way. So it's still really important that you are still advocating for them, whether it be from afar or actually in the community. So, ask the residents about their quarantine procedures. Do they have to quarantine when new move-ins come? If somebody leaves the building, do they have to quarantine when they come back? Because those are all really important. Again, a lot of these things are changing because, as everybody knows, residential care communities, senior living communities were one of the first places to get vaccinated. So hopefully your care community has put policies and procedures in place to get their staff vaccinated, to get the residents vaccinated, because that's also going to really help us combat this virus. The more people who are vaccinated, the more people who are vaccinated, more staff who are vaccinated in the care communities is going to significantly reduce the risk of bringing the virus into the buildings. So what is their policy? I mean, did they leave it up to the care staff, or was it a mandatory, or a requirement of employment? So those are all great questions to ask. What is your level of confidence that those CDC guidelines are being followed? Do you think that the care community is following those guidelines, or do you think they're kind of, at this point, we're all tired of it, but we still have to stay the course and we still have to follow those rules until this is truly over. So, making sure that everybody is still doing their part even a year later. Ask about, and hopefully residential care communities have been open and honest through this whole thing. Have they had outbreaks? Have they had people in the building with COVID? How many? Is it staff? Is it residents? Is it both? What is that looking like? Certainly, I would hope that everybody would be very honest and transparent when we're dealing with this. and making sure everybody's aware of any time that there is a outbreak in the building. Is your family member following the social distancing procedures, or are they even able to? If they live in an all memory care community, it's really hard. It's really hard to tell somebody with dementia they have to stay 6 feet apart. It's really hard to tell somebody with dementia they have to stay in their apartment. It doesn't really work. So what is the community doing about that, and how is that working? What is the personal protective equipment, PPE? You've heard that term a lot over the last year. Does the community have enough PPE? Where are you getting your PPE from? Are you in crisis? They call it crisis mode or something like that, where we're conserving PPE, or do we have enough that we're actually using a new mask every day, using a new gown every time we're in somebody's room? How many staff are interacting with your loved one on a regular basis? Have they limited that interaction? Maybe it's just several employees that interact with your loved one and not everybody, and again, increasing that risk. And are they able to limit that number? And how is the staffing ratio? Because we all know, senior living is notoriously infamous for short staff. Do they have enough staff right now? Are they able to keep staff? And those are all, they're tricky questions to ask, but they're good to know, because you want to be assured that if you can't be there in person, that the place, that the residential care community that you have your loved one is doing everything they can and meeting the needs of your loved one. And that goes along with all of these things we just talked about, and the number of staff that are in there. Do they have adequate staffing? Do they have adequate PPE? Those are all really important things to ask and be aware of. I like the gray box in the corner. No simple answers or a way to completely eliminate risk. Again, this has been a very fluid year. We've all been through a lot. We're all learning moment to moment. A year ago, things were changing literally minute to minute. We've been in it for a while now. We're all kind of getting the hang of it and getting used to things, but there's no simple answers, and there's no way to completely eliminate risk, especially in a communal setting.
So one of the difficulties that caregivers are having during this pandemic is figuring out, do I keep my loved one in this residential care setting? Do I move them into another assisted living? For caregivers that are trying to decide that piece, what are some considerations?
Yeah, great question. I think one of the main things to think about too is that no place is safe. No place is 100% guaranteed not to get COVID. There's no way to know that a residence will remain COVID free. Again, I think now, because vaccinations are becoming more widespread, that's a great place to start. If you are looking into moving your loved one, what's the vaccination rate at the new place? Because again, that's going to protect everybody there. The more people who are vaccinated. Are they even accepting new residents? One of our guidelines is if the community is in an active outbreak, they cannot accept new residents. So that would also be a sign, if they're not accepting new residents right now, they may be having some troubles of their own. They also may not have enough staff to meet everybody's needs. So those are responsible things that communities should do. If they're not accepting new residents, then why? Have there been COVID cases at the new location? What's their history with COVID? Have they had an outbreak? How long ago was it? How many outbreaks have they had? Because that will also, a lot of times we can't help it. It just depends on who comes in, but how are their infection control procedures? Because if they have had multiple COVID outbreaks, maybe there's something lacking in their infection control standards, or maybe it's just bad luck. So again, a lot of the same questions that we would be asking the current residential community, you'd also want to ask if you're considering looking at a new community. Ask those same questions. What's the staffing like? What's the PPE like? What are your procedures?
Another consideration that caregivers have been playing with is, should I just bring my loved one back home? What tips, what are the things that caregivers that are considering that option, what should they be thinking about?
Yeah, yes, and that's a big step, you know. I mean, there is a reason that your loved one is in a community. So we really have to look at what is their level of care, what is the day-to-day needs that they actually need, you know, what's their day-to-day routine look like, and can I meet that at home? Am I available to provide the care that they need at home? And the level of care, you know, and I would also really encourage, look at your support system too. Before you make a move like bringing them back home, what support do you have? Do you have multiple people that can come in and help you? Are you going to hire one of the home-based services to come in and help a few days a week? What happens if mom doesn't want to take a shower when you get her home? What happens if she's incontinent and you can't handle that? You know, you really have to look at, and I don't want to be a naysayer, but you have to look at worst case scenarios. What's going to be a deal breaker for you and your family? You know, if mom is really is incontinent of bowel, is that going to be a problem, or are you going to be able to handle taking care of that? So really look at their level of care and if you could provide it. Again, assessing that number of people that will be in the home that you'll need to take care of that person. How much contact are you going to have? Is it all going to be family, or are you going to be hiring people to come in and help you? What do you do in the case that somebody that your family member or loved one is showing signs and symptoms? Do you have a backup plan now in case your help comes down with COVID, you know? And are there people, you know, working outside of the home that are going to be coming in? Because again, the more we're out in public, the greater our risk for developing or you know, being exposed to COVID is. So how will you navigate that? How will you navigate lessening the risk and bringing it home? And again, you know, how much help are you going to need? Is something doable by just the family members that live in home, or are we going to need to bring in outside help and hire one of those home-based services? So again, it's a big step, but I think the main things to really look at is what is the level of care that my loved one needs, and can I meet those needs? And be honest with yourself, you know, and it's okay to say, this is going to be harder than I thought.
There's a lot of tips and considerations. So I know it could be overwhelming, but at the same time, you know, there's a lot of caregivers that are providing support at home right now. So let's shift gears into activities in the home and some tips. What does that look like?
Yeah, and it is, and that's so important because you want your loved ones to be active and engaged. But it's hard. It's hard because when you're caring for somebody at home, you take on a lot of different roles, right? None of us thought that we would be the nurse and the pharmacist and the chauffeur and the chef and the activities director and all of these things that go into being a caregiver. So part of keeping our loved ones active and engaged, and a term we use, contentedly involved, would be providing them activities. So I think a lot of times when we're thinking of activities, we tend to overthink, and we want them to be engaged and finish that puzzle and paint this picture. But something we need to remember is keeping it simple, slowing down, keeping it simple, and really just focusing on the daily plan, having a routine, but being flexible enough to change it because that your loved one may not be into doing the puzzles today or may not want to go for a walk this afternoon. So you have to make sure that you're flexible enough to veer from your plan. But it's always good to have a plan. Make it simple. Don't stress yourself out. I think, again, that's a lot of us tend to overthink activities and want our loved one to be, you know, just super engaged all day long. But sometimes it's something as easy as, you know, we're getting up, we're washing our face, we're brushing our teeth. We're going to go down and choose what we're going to have for breakfast. And maybe your loved one can put the toast in the toaster. Maybe all they can do is put the butter on the toast. Maybe all they can do is pick it up and eat it. So focusing on their skills and their abilities now, what they still can do. I think a lot of times family caregivers tend to focus on the things they've lost because it's easier to see the things they've lost sometimes than we can see the things that they still have and the skills that they still can do. So to be more successful, focus on those skills and what their ability is now. Like I said, it may not be setting the table, but it may be bringing their plate to the table. It may not be doing the dishes, but it may be rinsing their dish and putting it in the sink. So keep it simple and don't expect too much. And remember to keep their abilities in mind. We always use a term, focus on the doing. The joy is in the doing, right? We don't have to have a completed project. We don't have to have that beautiful craft finished. Focus on the fun that you're having doing it instead of the end product, because you might not finish the painting. You might not finish the craft project. The important thing is that you're having fun doing it. And the last thing on here too is, just be mindful of television. Television is awful right now, all the news and just bad stuff that's on. So if you're going to watch TV, make sure it's something fun and uplifting. Maybe it's the music channel on Xfinity that they really love. So keep it positive. There's a term that we use here at Spring Ridge is we make the weather, right? So if we're having a bad day, we need to leave that at the door. We need to go outside. We need to take a deep breath, and we need to bring our good attitude in, because whatever we're doing, whatever energy we're putting out, our loved one is following that energy and feeding off of that energy. So we make the weather, so make it sunny.
Thank you. Those are great tips. But caregiving is very stressful, and sometimes as caregivers, it's really hard for us to say that we need help, to acknowledge that we need help, or to even figure out if we're stressed out. Can you give us some tips on how to identify if we're stressed out, and what are some things that we can do?
Yeah, you bet. 90% of caregivers are women and, we're super women, right? We can do everything, not to negate that the men aren't superheroes too. But I think it's really important. The things that we really need to look at, especially identifying burnout and our stress levels. Off to the side here, you see off to the right, we have 10 symptoms of caregiver stress. Denial is a big one. Everything's fine. I'm good. Everything's good. It's okay to not be okay. And it's okay to say, I'm struggling today and I need some help. And give yourself permission to ask for that help. I think, we want to do it all. We want to be everything to everybody. But like Maria said, caregiving is a super stressful role in any aspect, whether it's caregiving for children, for adults, especially people with dementia. It's stressful. So be mindful of your stress. Be mindful of your anger. Are you really quick to just snap out and lash out at people, especially your loved one? Are you not accepting phone calls anymore? Are you kind of withdrawing, not accepting invitations to go places? Right now it's a little hard because there's not a lot to do, but be mindful of that social withdrawal. I know a lot of us are doing support groups and things like that online now and virtually. It's easier to forget to do that, or it's just virtual. I don't need to really be on the support group this time. Make sure you're not withdrawing. Make sure you're staying connected to, especially to your support circle. Anxiety, monitor your anxiety. That goes hand in hand with depression. So really monitoring yourselves for those symptoms, and then reaching out to your physician if you're really struggling, asking for help, talking to somebody. Exhaustion can go two ways too, where you just want to sleep all the time, or you're so exhausted that you can't sleep. So you're not getting a lot of rest. So your sleeplessness, and that will, again, we make the weather, and when we're exhausted and we're depressed and we're having, anger issues and we're withdrawing, that's all going to reflect onto our loved ones. And then they're going to have a bad time too. And that's going to make all of these symptoms even worse, right? So really keep an eye on yourself. We really want to make sure, if you're having health problems, get yourself to the doctor. Do not wait, because that's only going, if you're not well, how are you going to take care of your loved one, right? You have to take care of yourself before you can take care of anybody else. So it's okay to ask for help, and it's okay not to be okay. And keep your support circle close by. I used to teach a class called Savvy Caregiver, and one of our sessions we would have everybody write down, if somebody were to call you on the phone and say, hey, how can I help you today? Have your list ready so you can say, well, as a matter of fact, I'm really glad you called. I could use X, Y, and Z. I laugh because that may be the only time they call and ask if they can help you, but at least you got help that one time, right? So it's really important to if somebody asks how they can help you, tell them how they can help you, because we all need help. We all need it.
Thank you, Stacy. That's super important. I really appreciate you emphasizing the need for people to ask for help. Caregivers on a non-pandemic world, it's already so stressful. With a pandemic, it's even worse.
Yeah.
So I really appreciate that. Thank you. So let's shift gears again, because now I want to get into resources. So the Alzheimer's Association has a number of free resources available to the person living with dementia and caregivers. So let's start with one of them that I think is awesome. It's available 24/7. So can you tell us about the 24/7 helpline?
Yes, the helpline is amazing. Again, reaching out in the middle of the night when mom is doing something really weird and you're not sure what this is all about, you can call our helpline, 1-800-272-3900. It's 365 days a year. Somebody will answer the phone. What I love about the helpline is that these people answering the phone are highly, highly trained. A lot of them are clinicians and master's level clinicians, social workers. They've seen a lot, they've been through a lot, very well educated, know what's going on, and they can answer your questions truthfully and honestly. We have bilingual staff. We can translate in over 200 languages. So, even though if English is your second language, don't be deterred, because we can help you. We have live chats available online on alz.org. Again, great way to stay connected. But the best part is it's free, and it's 24 hours a day. So again, if you're struggling with something at 3 o'clock in the morning and there's no one else to call or reach out to, you can call the helpline and find out what to do, or what's going on, or why mom is doing this, or what's happening here. I love the fact that all of the helpline folks are trained for a minimum of 40 hours. Even if they're master degree clinicians, they're still trained for 40 hours before they even jump on the phones. And a lot of times they get over 80 hours of training just to answer the helpline. So they know what they're talking about. So it's an amazing resource. And again, it's all free.
So let's move to another wonderful resource. Right now we live in this virtual world, and that can make it easier to connect. So tell us about the virtual programs that the Alzheimer Society has available for people living with dementia, or caregivers and other members of the family.
Right. Yes. So the Alzheimer's Association offers education classes. That's my primary volunteer role at the association, is I'm a community educator. We used to do, pre-COVID, we did all of these in person. They've always had the online capability. You can go online and do these classes, but now even more so. You can do these free online e-learnings. Again, they're available at alz.org. When you're dealing with a disease like dementia, knowledge is power, right? The more you know, the better equipped you are to deal with things that are coming your way. I hear this a lot from family members. Well, I want to know what's going to happen next. Well, what can I expect? And it's really hard to predict with dementia because everybody is different. Everybody's journey with dementia is different. There's a saying, you've met one person with Alzheimer's, you've only met that one person, because the trajectory of the disease is so different for everyone. So that's why, going through these classes, going online and learning about these different things, anywhere from the very beginnings, what are the 10 warning signs? If you're very new to this and you're suspecting maybe something might be going on with mom or dad or your wife, you will go on and learn about the 10 warning signs, all the way to living with dementia late stage. We even have a class like that. So again, knowledge is power, and the more you know, the more successful you will be at caregiving. We even have a class called Legal and Financial Planning. I do not teach that class. A lawyer teaches that class. So you get great information straight from the people that know what they're talking about when you're dealing with that class. Because, the average lifespan for somebody diagnosed with Alzheimer's disease is 8 to 20 years. So this is not something that's going to go away overnight. This is not something that you're going to be dealing with for 6 months. This is a long, long process. So again, the more we know, the better equipped we are to deal with it. So these free online e-learnings are a fantastic way to, one, connect with the Alzheimer's Association and other people in your journey, but also learn a ton of information.
The other area where caregivers tend to have a really difficult time because there's no official caregiver school or class that you could take, right?
Yeah.
So tell us about the Community Resource Finder. I think this is a wonderful resource. And once again, these resources are free. So let me emphasize that piece. They're free resources available for everyone.
Yeah, which is so amazing and so important. The Community Resource Finder is excellent. So if anybody has even tried to step foot into, trying to find senior living, trying to find home care, home-based services, it can be super overwhelming, right? There's so much information out there. A lot of times we don't even know where to start. Well, the Community Resource Finder is a great place to start. And a great way to find resources, and just what it says, Community Resource Finder, finding resources in our community. What do you need help with? And it's broken down by categories. Am I looking for care at home? Am I looking for community service? Do I need Meals on Wheels? Do I need, something like that? Do I need Colorado Respite Coalition because I need to have a way to help pay for some respite or day programs? What are the housing options? What is the right kind of care for my loved one? Medical services. How do I get somebody to come out to my house to provide blood draws, lab draws? Is that even a thing? So great place to start. Of course, we have our own page about programs and events that are happening within the Alzheimer's Association and the Colorado chapter. AARP is part of the Community Resource Finder. Amazing group of people with just tons of resources. They offer a lot of free education programs as well. This website is a really great place to start, especially when you're dealing with how overwhelming all of this can be. So yeah, it's a great place for resources.
In addition to just trying to find resources and how overwhelming that could be, caregiving can also be a pretty lonely place.
Yeah.
So I think the next resource is super awesome. Tell us about ALZ Connected.
Yes, ALZ Connected. It's so important. Again, especially in this virtual world that we're living in, right? It's so hard, support groups aren't happening. They're all happening online, or, you can't go to coffee with your church group anymore. So we're feeling pretty disconnected. Well, alzconnected.org is a great way to connect with people who are going through the journey. It's hard, especially when you may be the only one that you in your circle of friends or that you know of that's going through this, who has a loved one with dementia. Friends and family try to support you, but there's nothing like somebody else who is in the journey to be a support. because they know, they get it. They're going through the same thing. So alzconnected.org is a great way to connect with those other caregivers. It's almost, I don't like to use Facebook because that's kind of a bad connotation, but it's kind of like that. I mean, it's a community caregiver forum. You can go on to different pages and talk about what's happening with your loved one. Does anybody else have this experience? And you can get feedback. People with dementia can go on here. People living with the disease can go on and connect with other people who are living with the disease. Have you experienced this? Has this happened to you? I'm not understanding this. Why do they say that? So for everybody in the family, this is just a great way to connect with other people who are going through the journey. Share the journey. It takes a village to raise a child. It takes a village to care for somebody with dementia. And this is a great way to find that village.
I love when you say that it takes a village to care for a loved one, because really having a plan in place is key. And I think the Alzheimer's Navigator is a great way to do just that. Throughout our conversation, you've mentioned a couple of times the importance of having a plan. Can you tell us how the Alzheimer's Navigator will help us to do this?
Yes, the Navigator is such a great tool. It really helps. Again, nobody wants to make decisions in crisis. Like I mentioned before, Alzheimer's, dementia is a long process. It's not something that just happens in 6 months and then we're done with it. So having that plan in place is not only, especially when you can start planning early on, once a diagnosis has happened, your loved one is still in early stages, this is a great time to start making that plan and using the Alzheimer's Navigator, because your loved one then can be part of the planning. I think it's such a gift to families when your loved one can express their wishes and their concerns and kind of work through this plan together. That way somebody, a son or a daughter or a husband and a wife are not having to make decisions for their loved one when it's not been discussed, or they don't really know what their wishes would have been and now it's too late. So this is a great tool to start those conversations, to start kind of working through some of those things that we need to plan for. How to work with your doctor, how to find the right kind of doctor. When you're dealing with dementia, our family doctors are great because they know a little bit about a lot of things, but when you're dealing with dementia, you really want to find somebody who specializes in dementia. So how do you find that person? How do you work with that person? What are some symptoms? What are the things that we're going to maybe experience? Safety, come up with a personal safety plan. What happens if mom starts wandering? What are we going to do? What kind of resources are out there for wandering? We have safety alert or, life alert. What county do we live in? Do they have life track in that county? Can we get signed up for it? So again, all things to kind of work through and things that you might not even think of when you're trying to go through this Alzheimer's Navigator. It brings up questions that people don't always necessarily think of needing to be part of a plan. So it's so great. Again, it helps link you with resources, connect you with people. The Alzheimer's Association has social workers on staff that can do care conferences and care meetings with families. So that's also a great tool to use. Use us, let us help you. And those are all free resources and free services to families. So again, great way to kind of start putting, some people are planners. That's just who they are. And this is a great tool, especially for those people, because it really helps you come up with a good concrete plan that can be followed. Just realizing that the best laid plans in life, right, are always meant to be broken. So realizing that we have a plan, but life happens and maybe our plan can't be followed, but it's better than not having a plan.
Stacey, thank you so much for sharing this time with us and providing us with all the resources, the tips for our caregivers. You come, like I said, with a lot of great information. The fact that you do the work that you do in assisted livings. That just enriches what you do for the Alzheimer's Association as a community educator. So thank you very much. Thanks to the Alzheimer Association, specifically the Colorado chapter. Thanks to their collaboration, we're able to do this today. Please remember that all of these resources are free. They're available online. Check out our description box in below. You will be able to link to all of the resources and have all that information. And we want this information to be of assistance to you. So we really hope that you're able to take this information and apply it in your caregiving journey. Thank you so much and be well.